Savannah Guthrie experienced a profoundly moving moment when she heard her post-surgery voice for the first time during a follow-up appointment with her specialist. The television anchor became tearful and embraced her doctor as the sound of her recovered voice filled the room, marking the end of a challenging recovery period. Guthrie had undergone surgery to address issues with her vocal cords that had worsened over time. She explained that her voice had gradually become deeper and scratchier, which she initially attributed to natural aging and the demands of her profession. Over the years, the changes grew more pronounced, and in recent times, it became difficult to complete sentences without strain. This prompted her to consult a leading voice expert who diagnosed a hemorrhagic polyp, essentially a ruptured blood vessel, on one side and a nodule like a callus from overuse on the other. The procedure involved microscopic laryngeal surgery to remove these growths and relieve the pressure on her vocal cords. Before going in, she recorded a message expressing eagerness to have it done and regain a normal voice. The surgery itself lasted about an hour, after which she faced one of the toughest parts: complete vocal rest for 8 full days, followed by near silence for another week. During recovery, she communicated through writing, with her husband capturing moments of her smiling but silent in the hospital. She described the initial adjustment to silence as difficult, even terrifying at times, forcing her to confront solitude and introspection. Yet she came to view it as a beautiful and spiritual experience, one she now feels grateful for having gone through. Upon returning for her checkup, the big reveal brought overwhelming emotion. Hearing herself speak clearly after weeks of quiet made her cry with relief. She hugged the doctor, expressing how good it sounded to her own ears. Guthrie underwent voice therapy sessions as part of rehabilitation and took 3 weeks away from her morning show duties to heal properly. When she returned, her co-anchors playfully noted how unfamiliar her voice seemed after the long absence. Reflecting on the entire experience, she spoke about the lessons in silence and being alone with oneself. The process highlighted how much she relies on her voice professionally and personally, and how its restoration felt like reclaiming a vital part of her identity. The journey underscored the importance of addressing health issues early, especially in high-demand careers, and the emotional depth that can come from forced pauses in a fast-paced life. Her openness about the ordeal resonated with many, illustrating vulnerability even among those in the public eye.